We're waiting on a... Okay.
You don't have anybody.
Okay.
Get ready to go. 3, 2, 1 now.
Okay. We do the same for you, Lane. Good morning, Queensland. We've received more encouraging news at our daily pandemic meeting with the Premier today. We have 10 new cases of COVID-19 in the last 24-hour period. They are all locally acquired and are all household contacts that can be linked to the Indooroopilly Delta cluster. 5 cases are household contacts of Ironside State School cases, 3 are household contacts of Indooroopilly State High School cases, 2 are household contacts of Brisbane Boys Grammar School cases. 8 were not infectious in the community at all. 2 were infectious in the community for 1 day, and that was during the South East Queensland lockdown period. That brings to 89 the total number of cases in the Indooroopilly Delta cluster, and 1,897 total cases for Queensland, of which 132 remain active. We did 48,028 test samples in the last 24-hour period, which is also a very, very good result. So across the metrics that we're monitoring most closely, the number of cases, the fact that they are linked, the number of infectious days in the community and testing levels, this is a very, very encouraging set of results for the 24-hour period. We now have 8,594 people in home quarantine, and I saw them described this morning as lockdown legends. They are indeed Queensland's lockdown legends, keeping us all safe. Unfortunately, we've seen Victoria go back into lockdown just 7 days after their previous lockdown. That means that we will again apply the hotspot restrictions, reciprocating the Victorian arrangements, so that those arriving from Victoria after 1 a.m. Sunday will need to go into hotel quarantine. Yesterday was also a tragic day for New South Wales, and our hearts go out to everyone in the Greater Sydney area and New South Wales more generally battling the outbreak there. Unfortunately, police report some declining compliance with the mask requirements. If you think about where this outbreak spread, it has spread in places we didn't have masks, schools and in households. And that just underlines how valuable masks have been at controlling spread in other places. And so we really need everybody to comply with those mask wearing requirements. But generally, Queensland, you're doing an amazing job. You're getting tested, you're staying home, you're wearing your masks, you are doing the right thing. I've never been more proud to be a Queenslander than I am when I see these fantastic results. All the indications are that it's working. We just need to keep it up. It's too soon to say what will happen over the next few days and whether we'll be able to ease restrictions on Sunday. I think when you read those heartbreaking stories of parents caring for their children in hospital with COVID-19, it brings home just what it is we're trying to avoid. So the results so far are very, very promising. We need to continue to see low case numbers, all linked, declining infectious days in the community and a high rate of testing. And if we can keep that up, then we will be able to begin to ease these restrictions.
Thank you, Deputy Premier. Yes, this is very encouraging news that we only have those 10 cases. 5 of them are children, 5 of them are adults. They were all in quarantine at the time. They were all household contacts. and just those 2 people had each had 1 day infectious in the community while the community was in lockdown. So that's all very reassuring, but we've got to keep it up for the next few days. We're not there yet. So we genuinely need to keep doing what we've been doing so effectively. So please continue to come forward and get tested with any symptoms at all. We just have to find that first case. If we've got any new cluster happening, we need to know about it as soon as we possibly can. So that's critical. And please keep wearing masks. These have made an enormous difference. They really and truly have. With Delta, we know that it is when people are breathing and interacting, and it can take only seconds for that transmission to happen. So please just keep wearing masks, keep coming forward and getting tested. Use that QR code so that if we do have any case, we can very rapidly get hold of everyone and get everyone into quarantine. It's those things that will keep us safe and enable us, hopefully, and I genuinely am hopeful that we'll be able to lift this on Sunday, but if we don't do all those things, it'll make it really difficult to lift Sunday. And then going forward, we're going to have to be incredibly cautious. We've seen what's happened in other states. We know that the Delta variant is a completely different variant to the ones we were dealing with last year. So I know it's very confusing for people, but we can't use the same strategies we used last year. We've really got to ramp them up. So thank you.
Well, this is great news for Queensland, and thank you to every Queenslander who's been doing the right thing and staying at home, going out and getting tested, and of course also coming out and getting vaccinated. To know that 8 of the 10 new cases today have been in the community for 0 days infectious is fantastic, and only 2 of the others had 1 day in the community infectious. But we need to make sure we continue to follow the rules. Stay home. If you are feeling unwell, go get tested. And of course, go get vaccinated. And it's wonderful to keep hearing news that our GPs are seeing a surge on people wanting to come forward and talk to their GPs about getting vaccinated. And we strongly encourage them to do that. Of course, great news, we will see pharmacies, community pharmacies in southeast Queensland starting to come online today. We have a vaccine going to 113 community pharmacies in southeast Queensland with Queensland Government vaccine stocks of AstraZeneca and consumables that we're providing to them while they wait for their Commonwealth supply to arrive next week, which will see more community pharmacies coming online after that. I'm very pleased to say that shortly after this press conference, I will be going to one of those pharmacies to get my second dose of AstraZeneca. And I have to say, the feeling of knowing that I'm going to be fully vaccinated after this vaccine today, it just gives me that extra level of confidence and comfort in relation to this vaccine and this virus. So everyone, if you are thinking about when to get your vaccine, please, if you are 60 plus, go and get your AZ, go talk to your GPs. If you are under 60 and you've already had 1 dose of AZ, like I have, then you should be going and getting your second dose as soon as you hit the 8-week mark. Don't wait till 12 weeks now. Come forward and see if you can get your second dose as soon as possible. Yesterday, we did the second highest number of vaccinations in the country, in Queensland. So well done, Queenslanders. Well done to our state-run vaccination clinics, the Commonwealth clinics and our GPs for the great work they're doing. Think of what we're going to be able to do once we get the extra vaccine and the pharmacies come online. It's really exciting to know that our numbers continue to go up, and as of today, 38.19% have had their first dose across Queensland, and we're now at 19.95%. So we're almost at 20% of the Queensland population who are eligible to be fully vaccinated. That is fantastic news. In relation to the report on the Prince Charles investigation, I've been advised this morning by the Director General that Professor Griffin wrote to him last night and asked for an extension of 2 weeks to deliver that report. Of course, we are very eager to see that report and what learnings can be gained from that, but the Director-General has advised that that extension is being granted, so we expect the report to be provided to the department on the 20th of August now. So again, stay safe, stay home, go get tested and get vaccinated. Thank you, Queensland.
Good morning. We increased our operational presence again yesterday, and I can say to the community, expect that to happen right up until our lockdown finishes, no matter when that is. We will stay very vigilant to make sure that people are doing the right thing. So out of the 3,445 vehicles intercepted in the points that we have in the southeast corner, we issued 20 penalty infringement notices. So that is a relatively low number, but nonetheless there's still some people that continue not to do the right thing. Overall, we issued 57 penalty infringement notices throughout the lockdown, and we arrested 2 persons, one of them being a person in Darling Downs district who on 3 occasions had been intercepted by police and continued to break the lockdown rules. So in the end, we had no option but to put that person before the court. We dealt with 120 calls for service, and 216 businesses were visited, and there was no enforcement action taken whatsoever. I just want to finish off on masks, because I think that's the one area that you've already heard from the Chief Health Officer and the Deputy Premier is an area that we need to do a little better in. Yesterday we handed out the most masks ever, 302. So that means that those 302 people were not only not wearing masks, they weren't carrying them. And we did issue 10 penalty infringement notices. That is the simplest thing to do. Just carry a mask and wear it when you should, and we'll all be a lot safer. Thank you.
Dr. Young, I don't want to get ahead of ourselves, but post-Sunday, if it is lifted, what would the restrictions look like? How tight might they continue to be?
It actually depends how we go the next few days as to what point we're at, and then the advice I'll provide. So it is a bit too early to say what will happen, but there will still be restrictions. There always are restrictions after we remove a lockdown. But the specifics of those restrictions, I just need to see how things track over the next few days.
And when will you make the lockdown decision, and would you consider giving businesses a bit more notice than, say, Sunday morning?
I doubt it will be before Sunday. I will want to see the numbers on Sunday morning. It's just too quick. We've only had the lockdown for 8 days. I'll need every single one of those days to be able to work through when and if we should lift that lockdown on Sunday afternoon.
Do you think masks could be worn until Christmas, even if there aren't any lockdowns?
It's possible, yes. Masks are just so critical with this Delta variant. They really and truly are. And it's an issue that if we want to try and avoid lockdowns, we're going to have to get used to wearing masks. Hopefully it won't be through till Christmas, but it could be.
What about under 12s wearing masks? You might have dealt with that yesterday. Is it possible?
Yes, Education has already done a fantastic piece of work, and they've found and sourced masks that are smaller, that will fit smaller heads. So we are going to look at some pilot work with maybe the older children in primary school. We're just working that through.
So
but people don't, there's very few places in the world that get children under 12 to wear masks. So we'll just work it through and see if it's beneficial and if we can do it.
What might be the youngest then?
I don't know. It really depends. You think about it, it depends on the size of the mask and that it fits neatly on the face, and also that the children can keep it on. I mean, I've had young children and trying to get them to keep, hats on and all sorts of things. So we'll just work through those sorts of things. But it might end up being those older children in primary school. But we'll work it through. Nothing's decided at this stage.
Can you clarify, there's been some talk on social media about a filming in Fortitude Valley and on Straddie. Is that allowed? Some of the locals aren't happy about it.
Yeah, people, when it's essential work and they can't do it from home, they are able, as you all are today, to go and do their job.
This might be a question for the Minister. There have been some questions raised about the value of the 8 Mile Plain 24-hour testing clinic. it seems to be virtually deserted during the morning. Would it have been better to move that elsewhere, or is it the right place?
Look, we assess these things on a daily basis as to where the demand is, the capabilities of the facilities and suitability, especially when they're drive-throughs, and the volume of traffic and any sort of impediments that those long lines of cars might cause. So we'll continue to look at that. I am still keen to see other drive-through centres being opened up around Brisbane, but we do modify the hours and the days. So this is just a short-term thing at this stage while we have this cluster happening right now. But we'll continue to monitor and change where we need to set up these.
So many others seem to be so busy in the early, from early morning right through. So you might be needed elsewhere.
I regularly get updates from the vaccination task force as to whether we're setting these up in the right places, whether we need to expand others, and whether we need to shift these. So certainly I'll get another report today on how that 24-hour centre's going, and whether we need to continue operating it the way we are, whether it's better placed somewhere else.
Do you know why an extension was sought for the Paul Britton report?
Look, I don't have the details. Obviously this review is going on independent, and I simply became aware this morning that there was an extension being sought. I'm not surprised. You think of the disruption that's happening across our hospitals right now, and any sort of work that's being done with interviewing health workers and so forth. Those health workers are also busy doing a whole lot of other things. But I am keen to see this report, and I understand that the extension is being granted on the basis that this report will be delivered on the 20th. There will be no further extensions.
And when will the public get to see the report if the government's getting it on the 20th?
Look, we'll wait and see the report. We have committed to releasing this report publicly, and we will do that. But we'll get the report first and consider the report.
Why not just release it on the day that you get it?
Look, we have to have a look at whether there's any confidential information, names of individuals, but it's appropriate that the government gets to look at the report before it's released. But we've made a commitment. It will be released public, just as we did with the Grand Chancellor report, and that's what we'll do.
Deputy Premier, would you consider giving public servants a day off to get the vaccine?
Well, Minister Grace is here and is able to address the industrial relations elements of that, but what I understand is that managers throughout the public service are being very, very supportive of our workforce getting vaccinated, and wherever possible are being flexible in work arrangements to facilitate that. Did you want Minister Grace?
If possible, please.
Deputy Premier, before you go, actually, Tom Tate says that he's been speaking to the Premier, and that he's been told that if the Gold Coast, one of the reasons the Gold Coast is being kept in lockdown is because Brisbane residents may try to sneak down to the coast. He says the state says that is their position, and that this is punishing their 66,000 small businesses and 680,000 residents. It's a quote he gave this morning. Do you think that is the case, that the Gold Coast residents are being punished because Brisbane residents might try and sneak down?
I spoke to Mayor Tate yesterday afternoon. What we've emphasised is that the Gold Coast has been included in this lockdown both because one of the originating cases of this outbreak was treated at Gold Coast University Hospital, and because there were exposure sites on the Gold Coast. I understand the concern that the Mayor has raised about its impact on businesses on the Gold Coast, but it's critically important that we take the health advice and we apply these restrictions to the geographic areas where there are concerns, and at this stage that includes the Gold Coast.
His line though, he says this, is because the government has told him they're worried about Brisbane residents sneaking down. Is that a concern?
Oh, look, clearly the Gold Coast is part of a conurbation that runs from the border to the Sunshine Coast. It's very difficult to put borders in place between the southern LGAs that are part of Brisbane, largely considered part of Brisbane, and the Gold Coast. There's lots and lots of roads between them. It would be very challenging to try to enforce movement restrictions there. So clearly that's one of the considerations, is what kind of sensible area can you put restrictions around. But that doesn't mean it will always be the case. There's certainly been other lockdowns where we've been able to restrict the local government area further. That depends on the risks of the particular outbreak. That's what we've monitored here.
Just quickly, is the Premier still due out of quarantine on Sunday?
She's counting down the minutes, I can tell you.
Has there been any update with discussions with the federal government about the Pinkenbar proposal? Has an MOU been signed or anything yet?
I understand officers of the Queensland Government continue to work very closely with the Australian Government on their planned quarantine facility at Pinkenbar, and we'll continue to do everything that we can to facilitate them building that facility and getting it online as soon as possible.
And has the state government been provided with an estimate for the running costs of it yet?
I don't think it's gotten to the level of detail of costs yet. The building costs will be borne by the Commonwealth Government. It's their facility, they'll be building it. The costs to us relate to policing and healthcare largely, and they're costs that we currently incur with our existing quarantine system. So we just have to look at whether those costs are the same when they're in the dedicated quarantine facility.
Does that concern you that you don't have an idea of the cost just yet? Does that mean it'll be pushed back?
I'm not too concerned about the building costs because that's the Australian Government's responsibility. They've said they will build it for us, and so questions regarding what they intend to spend there, I guess, can best be directed to them. In terms of the operating costs, we've just really finalised what the operating model looks like. We'll be continuing to talk to health and police in particular about how they can change what they currently do, take what they currently do in a hotel setting into this alternative setting. But I don't imagine it would be an order of magnitude more than what it costs to do in hotel quarantine.
So will public servants get a day off to get the vaccine?
Look, I'm not aware of any public sector worker, including casuals, that have not been accommodated with some sort of paid leave to be vaccinated. We're in discussions with unions at the moment. We have very generous leave arrangements, and we're considering a range of factors. Supply is always an issue, and of course the differing operational needs of agencies, but no public sector worker that I'm aware of, casual workers or any public sector worker, has been denied paid time off to be vaccinated.
Does that include full days, or are you talking like a lunch break or a couple
Whatever
hours?
they require in relation to obviously how they have reacted following their vaccine. But even this morning in conversations, most department heads have said that those who need to be vaccinated are being provided the paid time and whatever is necessary to get them back to work.
And is that additional to their usual, I guess, paid leave, or is this a special vaccine leave that they're being paid?
Oh, look, I think it's just part of the flexible work arrangements, as the Deputy Premier referred to, that are accommodated for these workers getting vaccinated. But supply is still an issue, and as the Chief Health Officer has said and the Health Minister has said, we encourage everyone to get vaccinated and they will be accommodated.
And one more, sorry,
Just one more, wasn't it? Just one more.
Just one more, the Chief Health Officer. Are there any concerns about the border bubble? Are there any concerns about the border bubble with the cases?
Of course I'm concerned about the border bubble, but I'm also encouraged that New South Wales is doing an enormous amount of sewage testing, and I get those results every morning around 7:30, and they haven't had any positive sewage detections in that border zone since they had that early one in Burke and then tested negative. We never found the cause of that detection, but since then they haven't had any. So they have had Armidale and Coffs Harbour test positive, but of course they're south of the border zone.
Dr Young, when do you anticipate under 40s may be able to get Pfizer, or is it all depending on the supply?
Well, it depends on supply, and that's a national decision.
Dr Young, just on vaccines, still a lot of noise from interstate about your comments on AstraZeneca for people under 60. They're saying there's vaccine hesitancy attributed to your comments. How do you respond to that criticism? Should we be doing more for people to get AstraZeneca under 60?
Right. Well, the ATAGI advice is exceptionally clear, and I have always followed it. So originally it was available for anyone down to age 18. Then it became restricted, or the actual words that ATAGI used is they preferred that people under 50 didn't get AstraZeneca but instead got Pfizer. So I went out, I'm over 50, I went out and got AstraZeneca. Then ATAGI changed their advice again because ATAGI is exceptionally good at what they do. They monitor the information from across the world every single day. So they changed their advice to say that anyone under the age of 60, it was preferred that if they hadn't had one dose, that they go and have Pfizer in preference to AstraZeneca. Then when we started seeing, in particular, this outbreak in Sydney continue to escalate, ATAGI again reviewed their advice and said for those people in an outbreak area that they, if they are under the age of 60, should talk to their GP and consider whether their circumstances, their own personal circumstances, meant that they should consider getting AstraZeneca. So that is what I say. So I actually do firmly believe ATAGI are the experts in Australia. They are very, very good at their job. So if you are 60 years of age or older, it is critical that you go and get that first dose of AstraZeneca if you haven't had it. And given we're in an outbreak at the moment, the ATAGI advice is that once you reach 8 weeks, after that first dose, you should go and get your second dose. And that applies for anyone. It doesn't matter what age you are. If you've had one dose of AstraZeneca, go and get your second. If you are under 60 years of age, the advice is very clear that you should go and talk to your GP and work through with your GP whether or not, given if you aren't able to access Pfizer because you're not in a priority group, then whether you should be accessing AstraZeneca. It is a personal choice and one that needs to be made with your GP.
One last one for the Deputy Commissioner. Last one.
Yeah, I'm just wondering if there's been any update on the quarantine basically down the Gold Coast. I think there's been a lot of fear at the moment as to if they are on the run, they're not exactly going to be checking in and letting people know where they've been, or see if there's any update on that.
We haven't yet located that person. We have been in contact with her. She has chosen not to cooperate with us. We'll continue to try and track her. And the whole circumstances of that are under an independent review that I've requested.
Are you aware of that? Is she being helped by family? Is she being assisted by people?
No, I won't get into the investigation's unfolding. Our priority is to locate this person, get her back into quarantine, make sure she has another test because she has gotten tested negative, I should say, negative already, and then do that bit and we'll deal with the other aspects later.
She's still in the community?
Oh, she's obviously out in the community because we can't locate her.
Is there concern about the fact that she tested negative, that there may be some virus risk?
We're putting a lot of resources into this to locate this person. I'm very confident we will soon. At this stage, we're not concerned because she has tested negative, but we want to be absolutely certain.
Thank you. See ya.
So we saw there was a business yesterday in Cannon Hill as well that they were told to shut or else they received a $4,000 fine. They are saying that they are providing essential service like a
look, to really clarify that, they weren't asked to shut. The advice was around the usage of masks and whether it was appropriate, the number of people were there. No one was asked to shut. There is no offence that they've committed, so we wouldn't take action for it.
Thank you.